Welcome, everybody. Thank you for joining today's webinar. We're letting a couple more people filter on in, but we should be starting promptly just around the 2 o'clock mark. So we'll give it maybe 30 or so more seconds, and then we'll go ahead and begin. All right, looks like we have a good number of people inside the crowd, so we could go ahead and get started. Hello, everybody. I am Corey Mullins with IATRIC Systems, and I'd like to welcome you to today's webinar. The topic for today is AI, HIPAA, and compliance in healthcare, what you need to know today. As a reminder, this webinar is going to be recorded and shared after this webinar, so if you have any colleagues that couldn't join us today, feel free to forward that along. If you experience any technical issues, you could always let us know in either the chat or the questions pane by navigating to that chat or Q&A icon. You could also email webp@iatric.com and we'll also respond promptly there. We encourage you to ask questions throughout the webinar, and you could enter those in the same questions or chat pane. We'll be answering those questions after today's presentation, but feel free to get those entered in as soon as they pop up, and we'll try to answer them as they come along. After today's webinar, we'll be sending a follow-up email with a survey, and we'd really appreciate it if you could fill that out. Today's speakers, we have some fantastic speakers today. From IATRIC Systems, we have Mike DeVoe, who's the principal application developer in our internal AI guru. We have Demi Baez, which is our product owner for patient privacy. And on MedCurity's side, we have Joe, who's the CEO of MedCurity and has joined us for many webinars in the past and is a wealth of information. And Molly Miller, who is the partner manager and has been an absolute pleasure to work with. So with that, I'm going to go ahead and pass it over to Mike DeVoe, and we'll get started.
Well, hello, I'm Mike DeVoe. I'm the principal developer at IATRIC Systems, and I've been with the company since 1999. I'm one of the original members of the team that developed Solomon, which is the AI detection engine used by two of our products, including Haystack IS, which you'll hear about later in this webinar. To many people, AI is a black box where nobody knows what's going on inside. So today, I'm going to try to shine some light inside that black box. AI is a broad topic, so let's break it down a bit. When people hear the term AI, it can sometimes sound bigger, more mysterious, or more intimidating than it really is. In practice, AI is simply a broad category of technologies that help computers process information, recognize patterns, and support people in making better decisions. It does not mean the system is thinking like a human being, and it also does not mean it should be trusted to operate without oversight. People are great at judgment, context, and nuance. We understand the gray areas. We can weigh intent, circumstance, and policy. Computers, on the other hand, are great at processing large amounts of data, finding patterns, and applying rules consistently. They can review far more information than a person could sort through by hand, and they could do it quickly and the same way every time. Machine learning sits inside of this space. It allows systems to learn from data over time and become better at recognizing what matters, especially when there are patterns that would be difficult to spot manually. You hear a lot these days about advanced AI tools such as agents, large language models, things like ChatGPT and Copilot. Those are powerful technologies, and they have made AI much more visible to the public. But it's important to understand that not every AI use case should work the same way, and not every AI tool is designed for the same purpose. Just within the last month, I read an article about how one of the latest large language models tried to blackmail the CEO in a test simulation. In this test, they mentioned it would be shut down in the future. This led to the blackmail attempt. Given the complexity of these systems, they had no idea how it arrived at that decision. So it's important to recognize that a chatbot, understanding and generating text, is very different from a machine learning system that analyzes activity patterns and highlights unusual behavior in a privacy monitoring workflow. That distinction really matters. So let's talk about how to use AI by starting off by talking about how not to use AI. We don't want to use AI to replace human judgment. That's especially important in privacy investigation. Machine learning can be very good at finding patterns, anomalies, and highlighting things that deserve attention, but it should not make any final decisions when the outcome could affect someone's employment, disciplinary record, or reputation. We've all seen examples of AI getting things wrong. Sometimes it produces answers that sound confident, but are simply inaccurate. In healthcare privacy, that kind of mistake can have serious consequences. So the philosophy is very deliberate. AI helps identify items of concern, but it's the people who make the decisions. Ideally, AI is for helping privacy teams find the things most worth reviewing. For example, maybe a user and a patient share the same last name. Maybe they share a guarantor. Maybe they live very close to one another, perhaps sharing the same backyard fence while having different street addresses. Individually, these facts may not mean much, but taken together, they may suggest a relationship that deserves a closer look. That is where machine learning is valuable. It helps bring these signals together, assign them a weighted score, and then add up the scores. It then takes that final score. If it passes a certain threshold, surfaces the event as a potential privacy risk for review. But again, the system is not deciding whether access was appropriate or inappropriate. It's helping a human reviewer focus their attention on where it matters most. I'll speak more about how we use AI in our Solomon detection engine, but this is a good time for me to pass it over to Joe, who will be discussing AI governance. Joe?
Thank you so much, Mike. What a great starting point for us and getting the lay of the land here. So yeah, this is Joe Galatly, and I'm joined by Molly Miller with MedCurity. And I will just take a few minutes to share from our work with hospitals and clinics across the country, what we're seeing as far as usage, where some early adoption of AI is really shining, some of the concerns that we see as well. And we want to highlight just to help proceed into this, with caution and to stay compliant. So next slide, we just have a quick overview of the company. And for those that don't know, MedCurity is focused on the security risk analysis and executing that for healthcare organizations. So again, that gives us a good opportunity. We're going into hospitals and clinics around the country every day through the year and getting that HIPAA requirement met where they go through and measure all their risks, right? All the threats that are potentially areas where PHI could get compromised. And so we measure that risk and then work to reduce that risk through the year. And it gives us a good line of sight on where breaches are occurring, where the potential for breaches are, and we can help coach organizations to say, hey, we're a little behind the curve, we're ahead of the curve. So in a topic like this, getting into applications of artificial intelligence, it again helps us see and maybe reassure organizations that they're not behind on this, or how to put some guardrails in to be able to lean in if you want to capture some efficiencies here and you want to experience and maybe even shape the future of healthcare with some of these tools. We're going to be your compliance perspective here in the next few minutes, and then just what MedCurity does day in and day out to help do that with guardrails. So next slide is just a quick look at the adoption, and hopefully everyone's somewhat aware of this and you're seeing this, but it's the dominant topic. If you make it to any healthcare conferences, it's usually the top theme of the sessions now are overtaken with how AI applies to X and Y throughout our organization. So So we see that occurring, and it's happening obviously in other industries as well. Healthcare, it's happening in pockets. And so I'm going to get into some of those applications that are making sense, and then some areas where we just want to tread cautiously, probably. So next slide. Some of those potential applications are touching all aspects of care delivery, but where I would suggest starting and looking for just some immediate help and leverage would be in operational support, administrative tasks. The number one application of AI that we're seeing deployed that isn't a support system. So Mike referenced like the privacy tools, the security tools. Those are rapidly improving because of this technology. But in the actual care delivery, the top application I'm seeing is ambient dictation, ambient transcription. So implementing tools that listen into the encounter and create that documentation for the providers. That has been across the board as it's implemented. That's been very well received by providers. Even technology hesitant clinicians have overwhelmingly given rave reviews on ambient dictation. So I'll come back to that a couple of times because people are looking for starting points, right? So our vendors are obviously working AI in anywhere that they can, and it makes sense, and everybody wants to talk about these tools. Some of it we just want to let play out a little bit more, but when it comes to the ambient dictation piece, that again is just where I think it's a good starting point if you're looking for a pilot. If you've already put it in place, fantastic. If not, that's just one suggestion that you could look at on the clinical side. To Mike's earlier point, we don't want to shift clinical care decision making over to the tools we have currently. We want them to support clinical care decision making and provide additional context and information. But gosh, if it can take out some documentation, if it can help us analyze vast amounts of information, like with chart auditing, there's a countless number of actions that happen in a week within the EHR. How do we surface something that really matters and deserves a little bit of a human eye on it? It's the same on cybersecurity. Tremendous amount of events happening. If you look at your cybersecurity posture as a healthcare organization, how do we really get to the ones that matter, the red flags that we really should have a human take a look at, right? So very powerful for those things. Going around the wheel here, I've heard a lot of good stories from the financial team as well, from the CFO and their team. They've been able to do analysis in a much more meaningful and accelerated way. So if they used to spend, in the larger healthcare organizations, a finance team will spend a couple days putting together dashboards every month or at least every quarter. That time is accelerated to where those can be produced near immediately. So then you have more of an ongoing real-time view, and you also can spend more time on interventions and going to the next level and actually working on issues that have surfaced. So a lot of this depends on the size of your organization, where it makes sense to focus. But I want to share some of those stories because it is good from a compliance perspective to look at how to enable those types of experiments and implementations, and not just to block them for now, but to say, how do we safely move into some pilots here? So again, the financial team has had some great uptake and efficiency gains from dashboard creation and analysis. The training element has been super powerful as well. So taking complicated guidance for patients and rolling it into a beautiful brochure. We've seen some of that and it's been used effectively. So not patient specific, but where you're putting an EPHI in there. But if you have a disease state that you're providing current frequent communication on, and you don't like your brochures, to feed that into a tool and get something more understandable, or something that translates into the top 5 languages you serve, or to a very obscure language, has gotten much easier, and it keeps you moving forward into this without needing to exchange PHI to get that done. So those are extremely good experiments. Staff training as well, of course, to be able to put together if there's new guidance from CMS for your coding team to know, to be able to put that into very easy to understand language, top 5 things that matter to you, send that out, post it. That type of distilling and communicating information, it's really good at already. something where you could feed, you could say, here's new guidance from CMS on this, the specific instructions or the new fee schedules. Here's the website for it. Give me something that's just broken down into one page of what I need to know. Beautiful use of AI. So seeing that as well. And then, I think we talked a bit about the patient-facing side of this, and then working this into compliance to help us analyze vast amounts of information. So a lot of areas to use this, and this is the starting point. I think we're learning more as we go and experiment and try pilots in our organizations. So this will continue to broaden out, but really it does touch all aspects of healthcare delivery, and that's why it's worth having these conversations. In the next slide, I want to just highlight a few of the benefits, a few of the reasons that people are putting this in place. One of the ways that I've heard mentioned in the field is looking at this as a starting point as what are the tedious parts of your job? A CIO of a large healthcare organization we work with told us that he likes to ask his staff, what sucks about your job? What is it that's painful and repetitive? And start there with how can we use some of these new tools to help automate those pieces of it? And that's an example of, Mike referenced the agents or agentic technologies. And that would be a quick example if you are playing with tools or want to try something out in a non-clinical data area, the Claude Cowork application. So Claude, if you're on their $20 a month plan, they have a desktop application you can download, and it has a function called Cowork, and Cowork will go off and do tasks for you. So you can tell it to go, fill out forms for you. Again, it's not something you want to be using for clinical data, but for other workflows, it's a great place to start using that. And it can go automate some of those tedious tasks or look up information and take actions for you. So it's a good tool to work with outside of PHI. And then we're seeing, plenty of new vendors. Again, if you go to a conference, you're going to see a lot of vendors talking about that are springing up, that are automating things like credential management and revenue cycle management. And in all those areas, they're interesting. They're just a good place to do, maybe look at three vendors, three of your favorite vendors, and try a pilot of them to get a sense of when they're really going to be able to do something that's useful and consistently accurate. But these are going to drive the adoption. The fact that we can take out the manual documentation, the manual work that slows down our clinicians especially, and bring productivity to all the back office work that we're doing, bring efficiency to that, and then teaches a lot of new information. So it's already been pretty incredible to watch what AI is doing for clinical research, but even in an encounter by encounter basis, the clinician will have a lot more real-time information at their fingertips, specific to the patient, specific to the conversation they're having, to help augment and support the patient care that they're providing. So overall, as you work to bring some of these tools in place, every position in your organization, whether you're a small practice or large health system, you want to have everybody in your organization working effectively at the top of their license, so to speak. As we say with clinical staff, we want them working at the top of their license. What are the things they do that someone else could do? Potentially, we could use AI tools to take over pieces of that. And that's what's playing out. And that's a good way to look at it, and a good way to explain it to staff too, is not looking to replace full jobs. We're not looking to replace the human element, but we really want people working at the top of their license, quote unquote, in whatever role they have, the top of their capabilities. So that's a huge benefit we're seeing from early adopters. So moving to the next slide, just really briefly, the costs that go into this. It is important to understand the long tail of this. Some tools are very inexpensive to bring in, but of course, there are some ongoing investment to keep those tools functional for you. So that's I'll get into cybersecurity a little bit separately. So I don't have to spend a lot of time on this, but there's a cost of course, training and adoption that comes into the new tools. I guess one note that I would make on cost as well, it's never been easier to build your own tools, your own dashboards. And so one of the frequent questions, and leaders that we're talking with is, whether they build things in-house or buy it or, sign up with a vendor. The in-house development, even though you can do something that looks pretty cool pretty quickly, the support of that piece falters, right? You have to have dedicated people to keep that running, or dedicated resources to keep something up to date and running and functional, especially when you start to count on it. So in the organizations that have been early adopters, we're seeing them skew more towards finding trusted vendors and then maybe just, some dashboards or some short-term workflows they're putting in place using AI tools. But so we're not seeing this shift to just build your own tools there. Organizations have gone down that path here recently and then switched to bringing in vendors that can really focus on that. They focus on the healthcare piece. So in the next slide, talk about some of those adoption challenges. And rolling through this, our role with the security risk analysis is to keep everybody focused on privacy and security guardrails as they move forward, just to ensure that we do this in a safe way. So as you start to implement new technology, as it's always been, but even more so with AI, it's a good time to pause, say, hey, do we have a policy in place that spells out how we're going to move forward? And hopefully the policy isn't just no use of AI, but it says, here's the tools that we do allow. Here are the requirements around them. We need a business associate agreement in place if there's going to be any PHI exchanged, any protected health information exchanged, right? And we need to understand where that data flows and how it's used. So I'll say that in some organizations that have taken a hard line against any use of AI tools, when we come in and do the walkthroughs in the clinical spaces, those tools are sometimes often in place already, because they make such a big difference, especially for the clinicians in their efficiency, taking out some of the tedious tasks. So if you're in the compliance world, the last thing you want to find out is that someone is using, we call it shadow AI, like we used to have shadow IT. Someone is using a tool that hasn't been vetted by you, right? That is, it's a provider who's recording the patients so that they can get a transcript that's the SOAP notes or final notes that are ready to paste into the EHR. It's so slick. It saves them a lot of time, but we're recording patients without consent. The information is being stored on servers for, some third-party system that we don't have a business associate agreement with, and then we're pasting into the EHR. That can happen because it's through your browser. That can happen without the IT department even being aware to some extent. So be aware of that as you're doing walkthroughs, as you're talking to people. I think the solution on that is to ensure that it's very easy for your providers, for your workforce to bring you their ideas and their requests, and that you can vet them, help take those early adopters and get them on pilots, give them tools they can use safely, instead of trying to not move forward. Because once a clinician gets a taste of going home at 5 p.m. with all their charting done, and that how much of a life improvement that is, or they could do extra encounters, that type of thing, it's hard to go back. So the ethical considerations would be a part of it. Is Mike alluded to how much we lean on the systems right now for care delivery, and we really want human in the loop on everything. We're not seeing models that are entirely accurate 100% of the time, and so to just blindly trust them when it comes to care delivery, we are not there yet. And then also understanding how those systems are trained, and that really comes into play on patient care facing AI systems, to ensure that they have a broad base of content that's pulling from the right sources. So if you're using it, like Open Evidence is a good example of a good solution. It's pulling from trusted clinical sources. If you're asking OpenAI or ChatGPT, you're getting information that's pulled from Reddit, that's pulled from broad sources across the internet. And so patients might be starting there, but we want to understand where the models that we use, how they were trained, what type of information was fed into it. And that helps us have a level of trust there as well. Okay, move through the next a little bit quicker, but the reskilling piece, I would say, just to highlight, we do see roles and jobs changing dramatically. So as much as I'm going to encourage you right now to spend time with these tools, to have conversations with the ChatGPT or Grok or Claude, the available AI agents, Learn how to communicate and interact with them now. It teaches you immensely about how prompting works, what their capabilities are, where they struggle. It is absolutely worth the time investment to spend time in these tools. Your staff, in the same way, giving them some time to experiment. If they are in roles that you could see being automated with the tools that are coming out, so if they're in a coding role, what's next for them? How do you, the top of their license might be fully automated. So what could be a position they can move laterally into, or what can they do once the majority of the work they do each day is automated? That's an important conversation and consideration to have right now. We're seeing the AI tools deployed as weapons. And so the phishing, many of you have probably seen the improvement out of the phishing emails right now, right? So the emails that we're getting in our inboxes are far more deceptive and well crafted than they ever were, in the past year, 2 years. So more and more organizations are experiencing breaches from very deceptive emails that trick you into clicking a link or providing credentials, being taken advantage of. The voice cloning is actually relatively easy to do. I haven't seen a lot of those events yet, as well as the deep fakes. So getting on a Zoom and seeing other people on the Zoom that aren't actually there, that are generated by AI, is doable. And there's a couple really high profile or well-worn stories of where someone has had an experience where they were tricked on a Zoom call. However, the breaches that we're seeing are not necessarily tied to that yet. So we'll keep posted on that when we do these webinars. We'll keep you updated on technologies to avoid those things, but they're not actually, they haven't yet been a big point of breach, whereas the phishing emails have been just severe. From small practices to large organizations, we're seeing the need to keep your staff very, I'll say, paranoid and aware of how tricky those emails are right now. Okay, the next slide. As those breaches come in, on the external side, the top type of attack that we're seeing is ransomware. And if you haven't lived through a ransomware attack, those are pretty brutal, where the protected health information is encrypted, locked up, and the attackers ask for a payment, typically in Bitcoin, to unlock or unencrypt that information. And in the past 12 months, we've seen that evolved where, the data is encrypted, the backups, if they're available, are encrypted as well. And organizations were getting better at having offsite or unavailable backups that they could then bring in and restore in the event of a ransomware attack. So now that data is also being exfiltrated. So before you even know the bad guys are in the system, they're taking a copy of the PHI, and then they're using that to try to strong arm the hospitals and clinics that have been through this into making the ransom payment. So then they will go contact patients directly and say, hey, we've got your information. We're going to put it out publicly if this organization doesn't pay us. So that's the brutal, terrible kind of attack that we're seeing nearly daily right now. And that's one of the big points of the security risk analysis is, what are all the pathways for that to occur? How do we avoid that and ensure that you're not in that position? We're still seeing internal threats as well. And that ranges from true malicious behavior, where someone's pulling information out to go use in nefarious ways, or just snooping incidents. And there have been Office of Civil Rights penalties applied against snooping incidents where someone was looking at charts that they weren't supposed to. And those, do a lot to destabilize trust in that organization, right? The community's trust of that organization definitely fractures a bit when there's either a ransomware attack or a big high-profile snooping event. And then, so there's a lot of threats under both of these categories. So again, with your SRA, just ensure you've listed those out, that you have tools like Haystack to prevent snooping and inappropriate viewing, and using tools to screen phishing, educate people on phishing emails, and have them be aware and paranoid when it comes to the links that they click. So lots under these. These are the sources of breaches that we're seeing in today's world. And the offense and the defense is being accelerated with the AI tools that are available. So I can jump to the next slide. I'm going to I've talked about this, so it's just a visual way to say, as you select from all these opportunities of where to get started. As you select the pilots that you want to jump into, we want to mock out the current workflow. So what happens today? This could be a very simple workflow, creating educational materials, or it could be your entire revenue cycle management department. Say, okay, where's our current workflow. We start with a pilot case. Typically, you want 3 vendors to screen and to work through, and to have them, do some pilots with them. And then out of that, hopefully there's a vendor. You do the same process if you're bringing in ambient dictation. What are the top 3 vendors right now? Who does your EHR vendor recommend, or do they have their own tool? That should be one of the 3 that you try. It could quite likely be the best, but you want to maybe try a couple different technologies here, and then have the providers try it, or have the end users try this. Security risk analysis needs to apply to these implementations, where we say, okay, so what's being put in place? Where does the data flow? What are the potential threats to that information? How do we protect it from being breached? And then this hasn't changed. Business associate agreements need to be in place. There's a lot of new startup AI companies that are springing up like crazy. So if it's not a trusted long-term vendor, we've seen instances where they're being built so quickly with AI tools that they aren't necessarily the most stable and secure platforms. And these are new vendors that are coming out quickly. So if it is a new vendor, get the business associate agreement signed and work with your partners to vet those vendors very carefully. The next slide is just about vendor managing. So I won't go further in that. This is just ensuring that you're asking for this type of information. So look at the slides or talk to us anytime. There's some key questions you want to ask those vendors to ensure that you know how that data is being protected and that you don't open up new breach sources. We've had too many breaches from third-party vendors here in the past couple of years. So we want to go beyond just saying the BAA and ask some tough questions to be on top of that. Okay, so we can move past this. I've talked about a few of these tools, and let me just wrap up with a checklist here to take a look at. And again, high points I'd hit here. The security risk analysis should be done every year. Just make sure that you have someone doing that security risk analysis for you and running through all the current threats that everyone's facing and the breach sources that they're experiencing, and saying, here's the controls we have in place to limit this and to try to lessen. We won't have zero risk, but try to lessen that risk through our controls we have in place. Running the network scans that should be in place. IT network scans are different than the SRA, but they also should be done. And training your staff, make sure that the training you use for HIPAA, for privacy and security, has notes on AI in it now, is giving them an idea of the risks that are brought in with AI technologies. And that's been very important in reviewing your policies to ensure that they match the current environment too. All of that comes into play. If there is any kind of incident, the Office of Civil Rights is going to look through much of the documentation that's listed on this checklist to be able to prove that you were doing the SRA is the first and biggest thing for them right now, and that you are managing risk all year long. So just want to give you a reminder on those things. None of that has changed. I'll close with the last slide from my talk. It's just, again, highlighting the security risk analysis. 90% of the breaches where there's been a penalty assessed, whether it was caused by ransomware or snooping, no matter what the breach it was, if they didn't have a security risk analysis done, that's where the penalties typically come into play 90% of the time. So we've got a great platform and team to support that. If you don't have a third-party vendor doing it for you, I'm happy to talk to you. I want to get one done if it's been longer than 12 months, and ensure that it's not just IT. There's physical standards, administrative standards, and it's evolving very rapidly with AI. So we're happy to chat with you more about that, and I'll pass the mic. I appreciate the time, and I think Temi, take it over.
Actually, I think it goes to me.
Oh, Mike, sorry.
I'm
Thank
ready
you,
to
Mike.
go here. Yeah, okay.
Perfect.
That sounds good. Okay. Anyway, I'd like to recall the story about the AI agent blackmailing the CEO. This highlights that we don't want to take any shortcuts by simply attaching an AI agent to a patient privacy product. Instead, we want to rely on machine learning. The concept of machine learning is now 75 years old and achieved widespread usability about 20 to 25 years ago. Its proven track record and our ability to understand, monitor, and control it are important. One of the biggest challenges in privacy monitoring is false positives, and we've done a lot of work to reduce them. For example, When trying to determine whether two records may refer to the same person, we don't want to rely only on name matching. We also compare information such as birth dates and other identifiers, including phone numbers, gender, subscriber, or guarantor information. That matters because there are plenty of common names in any database, so names alone are simply not enough. We also use advanced name parsing. Names are not always entered consistently. This becomes even more complex across different cultural and naming conventions. Hyphenated names, multiple surnames, and middle name variations. All of these things can create confusion. Machine learning models help interpret those differences more accurately so we can improve matching while again cutting down on noise. And just as importantly, the system learns from your feedback. If your team reviews something and determines it's not actually a valid match, the system remembers this, so you're not repeatedly chasing the same false positives. So humans still matter. This is really the core of our approach. The moment you let AI skip over human review and make decisions on its own, you introduce a risk. A system might flag something as suspicious, but that does not mean it was actually inappropriate. If you act on it too quickly, you'll likely annoy your providers or worse. So another question that naturally comes up is, how do we use your data? Our machine learning models run within your environment. Whether your organization's healthcare information systems is on premises or hosted in a cloud environment of your choosing, that is where the processing happens. We do not send PHI out to some external AI platform for analysis. That's an important part of our design. There's one very limited exception I want to mention, and that is geocoding. In order to compare the distance between addresses, we may send an address by itself with no patient name, no username, and no identifying context to obtain GPS coordinates. An address is just an address. But with two addresses, we can then use these coordinates to determine whether a user and patient live unusually close to one another, such as 200 meters or 500 meters apart. This is how to identify that employee and patient perhaps share a backyard fence or live the next block over and their kids perhaps play together. Even then, this is just another signal. It's not a conclusion. It's just one more factor your team may want to consider. Another important point is that every healthcare organization is different. A small rural hospital, a suburban community hospital, and a large urban medical center will all have different patient populations, staffing and naming distributions. The same distribution in El Paso, Texas is likely a very different naming distribution than you'd find in Honolulu, Hawaii. Even the likelihood of coworker access or high-profile patient access can be significantly different from one organization to another. For example, a small community hospital might see more legitimate coworker access. This makes sense because the only hospital in the community will likely be the one the staff chooses for their own healthcare needs. A privacy solution might also maintain a database of high-profile people, including celebrities and politicians. And you can even add your local TV news personalities. Perhaps hospitals in Nashville and Los Angeles see many public figures and celebrities. So identifying high-profile patients might be more important to you. It might be highly unlikely that Tom Brady will ever visit your hospital, but that name might be common enough that a Tom Brady might draw some curiosity, even though he is not the Tom Brady. So models should learn from your environment, making them more relevant to your organization's data rather than relying on a one-size-fits-all assumption. That makes the alerts much more meaningful, and it helps reduce unnecessary review work for your team. A privacy solution might also use machine learning to understand what normal activity looks like for different roles. For example, a nurse working in a surgical recovery unit will usually perform specific chart access and documentation tasks. That pattern becomes part of what normal looks like for that role, and machine learning will learn it for that employee's role. If the same role suddenly starts accessing information that falls outside of its normal pattern, it will likely be flagged for review. That does not mean the access was wrong. It means it was different enough from the usual pattern to warrant a second look. You might also want to look for unusually high levels of activity. If a certain role accesses a predictable number of patient records during a shift, and then one day that number is dramatically higher, the system can flag that as high activity. Often, there's a perfectly valid explanation. Maybe someone was asked to review a large set of charts as part of a quality initiative or infection review. Other times, the explanation may point to inappropriate curiosity or inappropriate access. The important point is that the system highlights the behavior, and then your team applies context and judgment. Overall, the use of AI is designed to make privacy monitoring more efficient, targeted, and practical for your team. We use it to reduce the noise, highlight meaningful patterns, and help keep you focused on the events most worth investigating, while still keeping human judgment in the center of the process. And with that, I'll turn it over to Demi, who will share some insight into Haystack IS.
Hi there, my name is Demi Baez. I am the product owner of our Haystack IS product, our patient privacy monitoring solution. I've been working with customers across many healthcare organizations, their privacy teams, for just over 5 years now. So I have a decent amount of experience in this field. So today I'll be dialing into HIPAA compliance and patient privacy in particular, and how AI can help and snowball into many different benefits when it comes to patient privacy monitoring. The first step is finding a trusted partner when looking to solutions that deal with AI. That's an essential piece. You have to ensure that they protect patient data, and that's done by ensuring PHI is handled securely with encryption, access controls, audit trails, that they support HIPAA compliance by aligning with HIPAA security, privacy, and breach rules. That they reduce your legal and financial risk by ensuring that the solution gives you the tools to minimize exposure to fines, lawsuits, and reputational damage. You might want to ensure transparency and trust by outlining clear policies on data storage, retention, AI model usage, that they scale securely by enabling innovation, but also maintaining compliance as operations grow. And then, most importantly, offers ongoing monitoring and support to your team. So before you partner up for HIPAA compliance, patient privacy in particular, it's important to identify where your current gaps are, where you're standing now, and where you want to be moving forward in the future. Managing patient privacy, it's increasingly complex just due to the massive volume of data in your organization. Privacy teams often struggle to identify issues and rely on either proactive manual audits or reactive investigations triggered by complaints more commonly. Without advanced tools like AI and machine learning, these processes, they're highly manual, they're time consuming, and they require pulling and analyzing large, very fragmented reports across many different systems, trying to piece those things together to get that full picture. And this makes it really difficult to efficiently detect inappropriate access or build a timely investigation. And as a result of this, privacy teams can spend hours, days, weeks on single cases, and that takes away from time to look at other things. And that highlights the need for smarter AI-enabled approaches to improve detection, reduce workload, and strengthen overall patient privacy protection and programs. So what is it that teams should be looking at? Patient privacy risks can be grouped into the 3 C's: carelessness, concern, and curiosity. This is how I kind of like to break it down, at least. Carelessness includes accidental errors like sending PHI to the wrong patient or incorrect record updates. And that's best reduced through training and reminders. Human error is a thing, it's going to continue happening, but with education and protocols, it can be minimized. Concern involves well-meaning but inappropriate access, and this can be checking your own records or those of family members, and that's often violating policy. Curiosity is the most serious category, and that involves unauthorized snooping into patient records, such as viewing a coworker's chart, a high-profile patient's information, maybe you saw your neighbor come in, and this typically leads to formal investigations and HIPAA violations. Managing these risks manually without the tools like a monitoring solution, it can be really overwhelming, which is why I often describe patient privacy monitoring as a mountain. The data, the systems, the people being monitored by your teams, they represent kind of the towns and the valleys at the base of this mountain here, while privacy teams, they're stuck navigating through dense, fragmented terrain trying to keep up. Without the right tools, teams are effectively just circling the mountain on foot, manually sifting through massive amounts of data. AI-enabled privacy monitoring helps teams move to the top of the mountain, so to speak, giving them a clear, comprehensive bird's eye view of activity so they can move more quickly to detect inappropriate access. They can uncover patterns and proactively prevent future incidents through better education and oversight. So let's take a look at the history of tracking different incidents. So first up, we have without incorporating software, AI, and automation. So prior to incorporating this, identifying and tracking incidents can be, as I mentioned before, very time consuming and tedious, and that's often taking days. Without these systems, teams, they have to manually pull in information and have very limited reports to use. And this just hinders workflow and can cause things to slip through the cracks very, very easily. After incorporating AI and automation, there is more time to cover a lot more ground. With the AI parsing your data and alerting to suspicious behavior for you, you prevent the fatigue from plaguing your team from sifting through all that data. This leads to just a more seamless switch from a reactive auditing approach to that proactive auditing approach that a lot of teams are looking to move forward to. So now that you've given your team the tools to succeed, found a right partner, this frees up time and resources, and your team can start focusing on the data that they're collecting with these investigations. They can start tracking case details, locations where certain inappropriate accesses occur, relationship trends, turnaround time for investigations. These are all essential to know kind of where your team sits and where you can move forward. You can also start tracking what type of breaches are occurring the most in your organization. Keep up with reporting to leadership or government agencies. Having all the information you need to track and manage trends in one place keeps things organized and your team working efficiently. So by tracking these details, you will start to see the bigger picture of the what's and the whys surrounding incidents in your organization. So for example, tracking types of breaches can lead to you having better education or policies for staff regarding those issues. Tracking relationships can help you better understand your staff and your community. Is it all family snooping? Is it friends, coworkers, neighbors? Tracking location can help dial into areas in your workforce that have higher investigations rates. So by tracking these trends, you can dial into high traffic areas of your workforce that may need supplemental education. Use it to determine who are frequent offenders and where they're located. This can also help build timelines for when education will have really the biggest impact. So just for examples, I've worked with many privacy teams, as I stated, and one of them told me that with our software, they noticed a spike in family access before holidays at the end of the year. And using this trend that they identified, they have scheduled education sessions in September and October, so that is fresh in front of mind for the users leading into that holiday season. And I just think this is such a fantastic way to use the data you're collecting. And the AI gives you the opportunity to to identify this because you're not running around that mountain. Another way they were able to use the trends they found was to help with overall program planning and effectiveness. If they knew that there are spikes in inappropriate access towards the end of the year, they can schedule projects that need to be scheduled for the beginning of the year when things are just a little bit quieter. And that's just allocating resources in the best way throughout the year. So Haystack IS in general, we leverage AI and automation, machine learning to surface suspicious activity that would otherwise be buried in those large volumes of data that you have. And that's reducing the need for manual, time-intensive review. Rather than teams spending hours searching for anomalies, the system helps identify that needle in the haystack and brings it forward for investigation. Our solution uses the machine learning to detect atypical access patterns, both compared to an individual user's normal behavior and to peers in similar roles. They also apply contextual signs, such as geolocation analysis to help identify risks like neighborhood snooping. And in addition, they can flag inappropriate access scenarios, including coworker curiosity, familial access, VIP patient access, and other high-risk behaviors. The use of AI in our system also allows you to kind of catapult into automation capabilities that streamline privacy workflows. So with us, we have an advanced virtual assistant called Ava that helps identify defined risk scenarios and can be built to automatically trigger notifications or follow-up requests to the users who made the access or their manager. And this reduces the repetitive information gathering during an investigation and allows privacy teams to focus on higher value work such as trend analysis, risk mitigation, and proactive education. So all of this, it just leads to more time for scheduling projects, workforce education, policy review, etc. And with that being said, I'll hand it over to Corey here for any questions.
Yeah, thank you so much, Demi. A quick reminder to the group, if you do have a question, feel free to enter it either in the Q&A panel or you can just drop it right inside the chat. We shared a couple great resources as everyone here was presenting today, so you should have seen a chat notification. If you can navigate there and you want to add to the Q&A, feel free to please do so. We did collect a couple common questions that we get, whether it is from customers or some of them we pulled from previous webinars to get us started and to give everybody here a minute or two to navigate to that space and type out your question. So the first question that I have, this is more geared towards Joe, and that is, how does the new HIPAA security rule proposed, changes affect us now?
Thank you, Corey. Great question. We're monitoring the Office of Civil Rights activity on this very closely for any additional guidance. There is a lot of vendor buzz about the 2026 changes to the security rule. There was a tremendous amount of change and increased requirements drafted, and this was the prior administration. It was put forward for review. Nearly every large healthcare association provided feedback on the security rule proposed changes. So they have a tremendous amount of feedback to work through. A lot of that would have been a heavy lift for healthcare organizations, and some of it is actually really meaningful and needed change. So it'll be interesting to see what they come up with in the final rule when that's published. They had it on their calendar for May, but again, this is from the prior administration. The current administration hasn't really provided any official formal updates or commitments on this. So I wouldn't retool your organization to meet the proposed rule because there's most likely going to be quite a bit of change to that before it's actually rolled out. We are watching very closely over the next 9 days to see if they follow their May calendar to put out some additional guidance or a new draft or a final rule. It would increase the number of network vulnerability assessments that need to be done, would require a penetration test. It changes some of the addressable requirements in HIPAA to be all across the board required. So those are things that I would say, stay tuned to IATRIC Systems, stay tuned to MedCurity on our newsletter. I'm sure we'll do webinars. As soon as that information is out, there'll be an implementation timeline. Then we want to start, reworking policies But most of the noise around it is vendors looking to move their products. And I would say don't retool a lot of what you're doing based on the draft rule. There are some good practices in there, but from a compliance perspective, it's likely to change before a final rule is put out. Thanks, Corey.
Yeah, thank you, Joe. We have a question here for you, Demi, and this is one that we pulled from a previous webinar. AI, of course, is the big buzzword inside the room, but one that is always shortly following behind it is automation. So we typically get asked, well, how is automation being used in patient privacy? And Demi, if you want to provide some guidance there.
Yeah, of course. So I mentioned briefly the Advanced Virtual Assistant AVA and just our use case. And just an example of how some teams are using automation with AVA is gathering information or following up with users after they make an inappropriate access. So let's just say, for example, user accesses their own record. It's not a HIPAA violation, but for a lot of the organizations we work with, it is a policy violation. So what they're doing is when that flags on what we call our event list, AVA automatically sends out a questionnaire to that user saying, you accessed your own record on this date. That's against policy A. We attach the policy and they're asked to review it and attest that they won't make that action again. And that does a few things. It frees up time of that follow-up from the privacy team themselves, and also acts as kind of a warning to users of, okay, they caught me accessing my own record. They're obviously taking this very seriously and they have tools to catch these things. So it's a little bit of training on top of just giving your teams more time. So that's just one example. There's many workflows you can use to follow up on different types of situations, such as the neighbor access, guarantor subscriber, family, etc.
Perfect. And just a reminder for everybody, if you do have a question, we're about to close the floor to stay on time, but if you do have a question, please navigate to that chat field, enter it in. And I have one more here for you, Joe, and I think this kind of segues nicely to some of our next slides as well, which is how often should they look to complete an SRA?
Yeah, great question. And it is typically annual. The guidance from programs that CMS puts out, like MACRA MIPS, the quality payment programs, is looking for that annual proof that you did the security risk analysis and that you manage that all year long. The regulatory code says regular basis, and any guidance from CMC and OCMS and the OCR expectations, it's been annual. So should be in the last 12 months. If not, it's a great time to get it done.
No, I think that's great. All right, we'll go ahead and move along over to the SRA slide.
Hi, everyone. My name is Molly Miller. I'm partner manager at MedCurity. I am going to post just some information on how to contact me in the chat. So if you want a little bit more information on your HIPAA compliance program, if you have any questions around HIPAA, I'd be more than happy to jump on a call. But I just want to touch base a little bit further on what Joe shared earlier. Right now, the OCR is really emphasizing ongoing risk management as not just a once-a-year exercise. The challenge for a lot of organizations is they're managing security, compliance, training, and vendor oversight across multiple disconnected tools, which creates a lot more operational lift and less visibility. And that's really where MedCurity comes in. We combine the software and services that help organizations simplify and strengthen their HIPAA compliance program. We provide third-party security risk assessments with on-site physical assessments, stakeholder interviews, because we know that strong SRA should reflect those real-world operations, not just a checklist. So beyond the SRA, we also support ongoing risk management through network vulnerability assessments, HIPAA training, and a business associate manager tool to help track vendor relationships and that documentation. The end result is a more defensible security and compliance program, better audit readiness, and more confidence and clarity around HIPAA compliance overall. If you'd like to learn more, please reach out or connect with me or Joe through the link in the chat. Thank you, everyone, for attending.
So this is Demi Baez again. So I also just wanted to take a moment just to go over some of our services apart from just the patient privacy monitoring of Haystack. So these our patient privacy managed services are designed to not only help your organizations who may not have the in-house resources to proactively audit today, but to also help existing teams extend their resources when unexpected challenges arise. And this could be an OCR audit adding more workload to your already taxed team, maybe an unexpected turnover, causing your resources just to be stretched a little too thin while hiring a replacement. Maybe you want your privacy officers to focus on training for a new software or policies without sacrificing their day-to-day responsibility. And with that, our managed services are a great tool to supplement your teams during these times, ensure that you have all the resources you need to maintain a proactive patient privacy strategy, and remain cost effective by only paying for what you need. And that's because patient privacy, it takes a lot of resources, and we do understand that those resources, they can get stretched thin very quickly, and we are here to help. So in particular with Haystack IS, as I've kind of gone through here, it provides unified data monitoring through a single centralized view. This enables teams to efficiently oversee all critical information in one place. It leverages AI-driven risk detection for intelligent threat identification. It includes automated AVA follow-ups, like I gave an example for, and that's just to ensure timely and consistent response. With investigations compliant with regulatory standards, organizations can confidently meet requirements, and centralized investigations keep all casework organized within a single platform, while at-a-glance trend tracking delivers quick visibility into those patterns and insights that I gave examples for earlier. And that just leads to more informed decision making.
Fantastic. Thank you, Demi. If you'd like to contact MedCurity, feel free to hit that link that Molly dropped inside the chat, and that is a very quick resource to get in touch with them directly. I have Joe's email on the screen as well as Molly's email, and you could always go to medcurity.com. For us at Iatric Systems, info@iatric.com is going to be your best place to try to get in touch with us, or visit iatric.com and you should be able to view any resource like our OCR audit readiness checklist, but you'll see we have information about Haystack IS, blogs, and all sorts of stuff. Of course, feel free to reach out to us on social media. We're Iatric Systems on all platforms. We do a great job making sure that social channels updated with industry news, product enhancements, and whatever else that we have going on in our community. So it's definitely worth a look. I want to thank everybody for joining today and giving us your time, and have a great day. Thank you all.